Good morning and welcome to another episode of Healthcare in Canada. I'm your host, Sophie, and today I'm presenting to you live with local vaccine expert Towobola. Towobola was just explaining to me about the MMR vaccine. Can you just recap for our listeners what the MMR vaccine is?
Of course, MMR is short for measles, mumps, and rubella, which are a collection of viral infections which the MMR vaccine protects against. Vaccinations are a type of primary prevention method used to prevent the spread of infectious diseases. The MMR vaccine is typically given to children at 12 to 15 months of age and again at 18 months.
Wait, viral infection? That means it's highly transmissible between people, right?
Yes, and they are dangerous. 33% of infants which contract congenital rubella die before their first birthday. Measles, too, is highly contagious with fairly high morbidity and mortality.
And the MMR vaccine prevents death?
That's right. These are vaccine preventable illnesses. It's estimated that the vaccine prevented upwards of 56 million deaths worldwide between the year 2000 and 2021.
But you said earlier that people aren't getting vaccinated.
Unfortunately, vaccination rates are down in Canada from 96% in 2001 to now 89% in 2019. And Canada has continuously failed to meet its goal of 95% coverage set in 2016, which aims to achieve herd immunity. This change is significant as the loss of a few percentage points can be the difference between eradication and an epidemic. The risk of vaccine hesitancy is apparent when we look to the re-establishment of endemic measles transmission in England from 2006 to 2014.
Why would vaccination rates go down?
There are actually a few common misconceptions that contribute to decreased vaccination rates. A popular one is that vaccines cause autism. However, the one study this claim is based on was thoroughly falsified by the lead researcher. Even though several studies had disproven the claim, 16.5% of parents and caregivers of autistic people surveyed still believe that vaccines cause their child's autism.
So what are some other misconceptions related to vaccinations?
The National Immunization Coverage Survey showed that 21% of Canadian parents believe that vaccines can make children seriously ill with the very illness it is intended to protect against. It was also found that 11% of parents believe that using homeopathic and naturopathic remedies can replace the need for vaccines.
So misinformation must be on the rise with the popularity of social media.
Yeah, social media allows the swift dissemination of myths about vaccination, making these networks a major factor contributing to the vaccine hesitancy. One study found that vaccination rates decreased following the spread of misinformation online.
If I want to avoid buying into misinformation, how can I identify it?
It's important to improve your health literacy, which is your ability to find, understand, and use information related to health. There are a few strategies, including developing a critical mindset and checking sources.
Do you have any suggestions to help people develop a critical mindset?
The Government of Canada released an article on misinformation which outlined key questions to ask yourself when you are intaking information. The first question is, if the information invokes an emotional response, you are more likely to react and give in to the power of suggestion. Next, identify if there is a bold statement on a controversial issue and if it's making an extraordinary claim. If the information seems too good to be true, it probably is. Check if the source is just drawing attention to sell something, and check if the information is correct and in context. And finally, evaluate the authority of the people spreading the information and the validity of the platform. Information spread on major social media platforms are not going to be as reliable as government sources and scientific sources.
Those seem like fairly easy things to keep in mind when taking in information. They're like the red flags of information.
Exactly. Importantly, though, it is also the responsibility of public health officials and governments to improve health literacy and dispel misinformation about vaccines. This is a form of primordial prevention. While individual action is helpful, intervention should be made to address the issue as well. Public health campaigns which preemptively inoculate against misinformation have been shown to be effective. Highlighting the medical consensus surrounding the safety and effectiveness of vaccines has been shown to increase public support and decrease concerns.
That's interesting. How might a public health campaign like this work?
A Canadian campaign would need to be specific, tailored to the kinds of prevalent misinformation people have been exposed to, like the ones I mentioned before, and the effort would be more likely to be successful if the tailored messages come from several trusted sources. In addition, for the long run, Canada could consider bolstering its curriculum for health, media, and digital literacy in schools to provide kids with these tools before they themselves have to make decisions based on health information.
That's great to know. Well, thanks for joining us today. This has been a very insightful segment on vaccinations and misinformation. And to our listeners, thank you for joining us. I hope that we have provided you with some insights on how to identify misinformation. This concludes another episode of Healthcare in Canada. Bye for now.